Rhinoplasty, also known as a nose job, is basically the reshaping of the nose. It can be done on the outside or the inside for function or for cosmetic reasons. The most common thing we see is what we call a reduction rhinoplasty, meaning that most people want a smaller nose. Usually that entails bringing a bump down, or maybe making the nose less wide, or making the tip a little thinner. Frequently, people have broken their nose in the past and it's crooked one way or another, and they wish to have that straightened as well. A rhinoplasty surgery takes about 3 to 4 hours. It's performed under general anesthesia, and typically you go home that same day. Is there a lot of pain after rhinoplasty procedure? Interestingly enough, there really isn't much pain. Now, we do place what we call stents inside the nose, and they're kind of like thick straws. And they're there to help keep the inside of your nose open to allow air to breathe in. Most people describe those as uncomfortable. Not really painful, uncomfortable. Once the stents are removed, most people do not require any pain medication after that. The bruising after rhinoplasty surgery is typically around the eyes. The bruising can last 2 to 3 weeks, but we do offer laser treatments for the bruising, and that can start as early as the day after the surgery, and there's no charge for it. After the rhinoplasty surgery, you can expect a cast on the bridge of your nose, and like I mentioned, the stents that are inside the nose. The stents are removed at 3 days, and the cast comes off at 1 week. Frequently after the cast comes off, if there's still some residual swelling on the nose, I may use some tape or a cast for the patient to use at night. I prefer that the patient stay in bed for that first night. After that, they're free to walk around the house, they're free to walk their dog in the neighborhood, but no vigorous exercise. After 3 days, you can start walking a little bit more briskly and doing maybe chores around the house. At 14 days, you can start doing mild to moderate exercise and full exercise at 1 month. No water sports, no hot tubs for a month. The reduced activity is mostly to control the swelling and the bruising, as well as bleeding, which can occur up to a week after the surgery. It's about 1 month until you're pretty much back to normal. However, you still may have some swelling around the tip and the sidewalls of your nose, and that won't resolve for about 6 months to a year. One of the most important parts of a rhinoplasty consultation is to set the proper expectation. With the use of technology now, we are able to do that quite well by taking photographs of the patient, showing them on a computer screen, and from there we can do a simulation on what is a reasonable outcome for that person, for that nose, with surgical correction. It's really satisfying for me to see our patients come back and they feel like the nasal surgery has changed their lives. It has given them more confidence, and on top of that, they frequently say they're breathing better, they're smelling better, they're tasting foods better, because we were able to open up their nasal airway.